Nucleocapsid. Capsid is a icosahedral in symmetry which is made up of core protein. You can see this is a core protein inside which there is a dense cylindrical inner core which encloses. This contains RNA and viral enzymes like reverse transcriptase, integrase and all those will be there. See RNA, you can see RNA. These are reverse transcriptase which helps in conversion of RNA into DNA, which a transcription was like a transcriptase was doing converting RNA into DNA. ACE is there, no? So there are enzymes. You see reverse transcriptase, integrase, protease. This ACE whichever ends with ACE, those are enzymes. RNA, two identical copies of single stranded positive sense linear RNA. Two copies for positive sense like normal helical structure. They are identical. Linear RNAs are there. Enzymes, there are three enzymes. You can remember RIP, that is reverse transcriptase, integrase and protease. RIP you can remember, which are closely associated with the HIV RNA. Then HIV genes and antigens. HIV contains 3 structural genes, that is POL, GAG and NV, and 6 non-structural regulatory genes. Structural genes forms various components of the virus, that is GAG. GAG encloses the core and the shell. This core and the shell is formed by the GAG gene. In the virus, it is expressed by the precursor protein, but that is P55, which is cleaved into 3 parts. This P55 will be cleaved into 55 will be divided into 18, 24 and 15. This 18 makes the matrix or shell antigen. 24 and 15 constitute the core part is constituted by 24 and 15. The POL gene codes for the viral enzymes, that is RIP. I asked you to remember RIP, R for reverse transcriptase, I for integrase and P for protease. It is expressed as a precursor protein which are cleaved into this P31 and this P66. P66 is cleaved into P31 and P55. P55 codes for reverse transcriptase whereas P31 codes for integrase. The NV gene codes for the envelope of the glycoprotein, that is GP160. 160 is again cleaved into 41 plus 120, cleaved into 2 components, that is GP120. It means the main receptors of the HIV, which that binds to the CD4 molecules, that is lymphocytes present in the host cell. It binds to the G120 protein, goes and binds to the host cell receptors and initiate the infection. The infection process is initiated by the pairing of GP120 with the CD4 cells. And GP41 is a fusion protein which helps in the fusion of the host HIV virus into the host cell. Non-structural genes regulate the viral replication. This helps in viral replication. This is also helping in structural genes, also helping in the viral replication, because integrase helps in the integration of the viral DNA with the host DNA. So this also helps in viral replication. They are important in disease pathogenesis also in living organisms in vivo. They can be grouped into essential regulatory proteins, that is a TAT, transcriptional transactivator, and NEF, negative factor, and REV genes. Accessory essential regulatory genes and accessory regulatory genes these are the 2 types of regulatory genes. Accessory regulatory genes include VIF, that is viral infective factor, or VRP or VPU. These are not that important because these are not RS questions. How much you can remember, those you can remember. Antigenic variations and diversities. HIV shows extensively antigenic diversity, and it is under the high rate of mutation because it keeps on mutating. We can't rely on the same drugs, because as soon as you inject the drugs, there may be chances of mutation, and so the elimination of this is not possible. This is believed to be due to the error prone nature of the reverse transcriptase. Reverse transcriptase will be doing errors, so that mutation will be very faster rate. As it does one error that transfers into new viral proteins, so new viral particles will be there. So the drugs against which was discovered can't be effective against the newly formed this thing. Different mutations will be selected under the different conditions, like host factor. It depends upon the host factor, immune response and tissue types. All the mutations may occur in any genes. Most notably this is observed in the NV gene. We have POL, GAG and NV gene. Most commonly mutations occurs in NV genes. Unfortunately, envelope proteins happens to be the major target against which antibodies are produced. So envelope proteins, against envelope proteins only antibodies were produced, but this is only mutating, so these antibodies produced against these envelope proteins will not be effective. Unfortunately, envelope proteins happens to be the major target against which the antibodies are produced. Hence, the mutation of envelope gene are main reasons which explains why HIV invades the host immune response. So, this keeps on destroying the host immune response. And vaccination against HIV is extremely difficult because of its high rate of mutation. This mutation is because of error-prone nature of the reverse transcriptase enzyme. Pathogenesis. Mode of transmission. HIV is transmitted through the following modes, that is sexual mode is by far and the most common mode. This is the most common mode of transmission. It accounts for 75% of the cases in the world. Heterosexual route, that is male to female via vaginal coitus, is the most common mode. However, the risk of transmission through the sexual route is minimal, that is only 0.1 to 1%. There is a chance of this, like only 0.1 to 1% is there, but most of the people who are infected will be like 74. If you consider 100 people, of which 75 people are infected through this route, but the mode of the chances of transmission is the chance is only 0.1% to 1%. But most commonly, people who are infected are transmitted by this route. Anal intercourse among homosexual males and even male to female has higher risk of transmission than vaginal intercourse. These homosexual people will be having more risk than the heterosexual people. And then coming for blood transmission, this is one of the mode of the transmission of the virus. It is the least common mode of transmission, that is only 5%. But the risk of transmission is more if the virus is in the blood, and if the person gets through the blood, transfused by the blood, there is more chances of getting, that is 90 to 95% chance is that he gets the disease. But the transmission rate, like because blood will be screened before transfusion, so the chance is less, only 5% is there. But if he acquires through that, 90 to 95% chance there is that he gets infected. Then precautions or percutaneous or mucosal transmission modes such as needle stick injury and injections during the abuse, or sharing razors or tattooing or splances of the infected blood on eye, etc., are among the less infective modes of transmission. Through these other fluids like in eyes and all will be having tears, and then needle stick injury, this will be more surgeons are the more risky people who are working in the healthcare centers will be getting through this route. And perinatal mode, in the absence of any intervention, the risk of transmission from the mother to the fetus is only 20 to 40%. Transmission may occur at any time of during the pregnancy and breastfeeding, but the risk is maximum during the delivery. During the delivery, the mother's blood will be exposed to the fetus, so there is a high chances. And then through the normal vaginal delivery, the fetal mouth and eyes will be in contact with the vagina, so there is more chance of transmission during the delivery. Risk of transmission if the mother is recently infected has more than or has already developed the AIDS. AIDS is one of the stage of HIV infection. In HIV, first the asymptomatic stage will be there, then AIDS will come. In this phase, if the mother is in this phase, then she gives birth to the child, there is more chances if she is already AIDS patient or recently she acquired the infection. There is no evidence of HIV transmission by the casual contact or kissing or by insect bite. There is no insects cannot act as a vector for the transmission of HIV. Viral load is maximum in the blood and genital secretions and in CSF, but it is variable in breast milk and saliva. So oral sex is advised for them. 0 to minimal in other body fluids or urine. In other fluids it will be minimum, so maximum it will be in the blood and the genital secretions and CSF, variable in breast milk and saliva, but 0 chances there in urine and other body fluids like pleural fluid, then pericardial fluid and all those, synovial fluid and all. Saliva may contain inhibitory substances like fibronectin and glycoprotein, which prevent the transmission of the viruses. So salivary transmission, that is oral sex, is advised. So because this contains fibronectin and glycoprotein, which prevents the transmission of viruses.